they didn't have. That's why the overage last year was such a surprise. Also, within our accomplishments is our leadership. Last summer, we were dealing with very low staff productivity. We have to have a productivity rate of at least 60% to break even in the program. With the productivity so low and our expenditures so high, we appointed a new interim mental health director on October 22nd of 2007. With the addition of Mary Elliott, we now have a solid accountability structure for the clinical staff and productivity. Also, with the leadership of Mary Elliott, we have more program stability than we had before her appointment. We now have a dedicated clinical billing trainer to maximize our Medi-Cal and our EPSDT billing, our reimbursement. And we began to plan for greater integration efforts between mental health and social services to leverage more dollars to sustain mental health services. We saw that in 07-08, and we're going to see it in 08-09. We'll begin to implement our adult system of care, starting with mental health and social services. What we're able to do is leverage social services dollars, basically state and federal funding, to sustain mental health services. If we don't continue with the integration between mental health and social services, we are not certain that we could sustain adult mental health services in this county. We'll fully integrate children's mental health services, also allowing for greater leveraging of funds one more time. And we'll develop additional data collection tools so we can measure program status and also measure performance in mental health. The agency will be accountable to report back to this board regularly on mental health services, sustainability, and stability. In closing, I'd like to say that sometimes the road to success is full of twists, turns, and bumps in the road. But we learn from those bumps, as you're about to see. You'll be hearing a little bit later this morning also from the Mental Health Advisory Board in their annual report. And then Mary Elliott will wrap up with Mental Health Month. I'd like to again thank this board for your support and also for your vision for mental health. Thank you.
Thank you. Comments from the board?
Wait till that's done.
Okay. Comments from the public? Anyone from the public wishing to speak on this proclamation? Okay, seeing none. Did we take a vote, Madam Clerk? Yes, we did. Okay, next item. Okay, the next item is presentation of Mendocino County Mental Health Board's annual report for fiscal year 07-08. And the sponsoring department again is the Health and Human Services Mental Health Branch. So, Ms. Elliott, okay, please.
There was a vacation.
Okay. And if you could start off by stating your name, please.
My name is Laura Lee Mannix, and I'm the chair of the Mental Health Board. I've been on the board for over a year and have been inspired by the dedication of the members who have been on the board for several years. We are all concerned for the future of mental health services in the state and in our county. Our membership is currently small, and we hope to add members in the near future. We ask the Board of Supervisors for assistance in recommending and appointing citizens who can serve on the board. The Mental Health Board has had some concerns over the past year. In October of 2007, an interim mental health director was appointed without any input or recommendation from the Mental Health Board as mandated in California statute. The Mental Health Board, per Section 5604.2 of the Bronson-McCorkdale Act, says that the Mental Health Board shall review and make a recommendation on the applicants for the appointment of the local director of mental health services. The board shall be included in the selection process prior to the vote of the governing body. Although we understand that the interim mental health director can be appointed by the Health and Human Services Agency director, it has been clearly stated that the current interim director is going to become the mental health director. The Mental Health Board was not a part of the selection or application process for the appointment of the interim director of mental health. Further, the restructuring of the Mental Health and Social Services branches scheduled for July 1st, 2008 will result in a change in the Director of Adult Mental Health Services. This person, by all accounts, will also be chosen with no input or recommendation from the Mental Health Board. The County Mental Health Board members feel that this is a clear usurping of our mandate to have input on these appointments. The second area of concern for the Mental Health Board has to do with financial impact that late medical reimbursements from the state, which fund client mental health care, has on the mental health branch. We understand that the state notoriously is more than a year behind in making these payments to the county. We also understand that Mendocino County loans the mental health branch funds to keep operating until the Medi-Cal monies are received. What we don't understand is why the county levies interest charges to the mental health on that money. The mental health budget is very tight and must be paid for with realignment dollars and Medi-Cal reimbursements, which are also reportedly going to be reduced. We strongly believe the county should not be charging the mental health branch interest on these loans due to the negative fiscal impact on their already seriously challenged budget. Our current members have put together reports on children's services and adult services, which are attached. I will first summarize the reports and problems and recommendations that our members, along with mental health staff, have identified. The overriding theme in all areas of mental health services is that the staff is a cohesive and wonderful team dedicated to the clients. However, staff morale is very low. The following reasons have been cited. First, over the past 3 years, there have been 4 mental health directors. Each time the change in leadership has taken place, staff unease and discomfort have become evident. Staff doesn't know what to expect as the leadership changes occur. They fear for their jobs and the uncertainty that follows. Each new director has a huge learning curve and his or her own style and expectations. It takes time to build trust and respect for the new leader. Second, there is no clear definition in writing about whom the mental health branch serves. Line staff feel conflicted when they are asked to do many things and must decide what their priorities are. Alcohol and other drugs programs, AODP, has defined clearly and in writing what they do and whom they serve. This is reported to have helped their staff tremendously. A similarly clear written statement could also be used to clarify priorities for staff and educate the community at large about the role of mental health branch and its mandated limitations. More changes are coming with the mental health branch integration with social services. Adult services will have a change in director, and we do not know whether this individual will have any clinical experience in mental health, similar to what has occurred with the current interim director. Staff is cautious about whether the integration will be good or bad for their clients and themselves. Children's services staff is concerned that their clients will fear social services involvement, as social services is often seen by the public as the people who take children from their parents. On a positive note, some staff feel that mental health clients may be less stigmatized when they are associated with social services. The Health and Human Services Agency has set up a professional standards committee to ensure that the standard of care is not diminished by this integration. Line staff will be part of this committee, and it is hoped that administration will truly listen to staff to help this make this a smooth transition. One of the major concerns and focus for all of mental health staff seems to be to bring home our clients who are placed in out-of-county board and care facilities or acute psychiatric hospitals. Creating more types of housing in the county for these clients is the primary goal, and it is encouraging to see that everyone is working towards that goal. Thank you.
I too want to thank the Mental Health Board for taking the time to write this report. I know they put a lot of concern in it, and they genuinely care about what happens to the mentally ill in our community. I wanted to clarify a couple of what I consider inaccuracies. Because I don't get a chance to talk to you very often in person, and I wanted you to hear my perspective. I have repeatedly stated in almost every meeting